Good afternoon and welcome to our web-based engagement on leveraging AI equity, access, and inclusion for all series. This is session 1 of 5, titled A Foundation on Artificial Intelligence and Disability, brought to you by the U.S. Access Board. Before we get started, I want to share a few housekeeping items. First, as we progress through this presentation, you'll see in the chat box a link to the PowerPoint slides. We've tried to make sure that we've included all the highlights of the points we're trying to address throughout this session so that you can follow along as a guide and/or share these notes with others in the disability community. So let's get started. I'll first introduce myself. My name is Allison Levy, and I work for the U.S. Access Board as the Director of the Office of Technology and Information Services. I oversee the team of amazing subject matter experts on a variety of accessibility features in the built environment as well as the digital environments. First, I want to start off giving you a brief overview of what we're planning to cover today. We have some very important guest presenters as well. But first, I'll share a little bit about the Access Board for those of you who haven't yet learned about us. Second, we'll share some information about what is AI and what does it mean to end users. Third, we'll talk about how artificial intelligence or AI can impact people with disabilities. And last, we'll talk about next steps and how you can become more engaged in our conversation about AI and planning for our future. Now I'll change gears and talk a little bit about the Access Board. Just 3 basic points for you. First, we were established to provide accessible design, guidelines, and standards. And we were initially set up to support the Architectural Barriers Act, which is the first law that covers physical access to the built environment. We also enforce the ABA, so covering federal facilities and buildings. If you see an accessibility barrier for the built environment, you can reach out to the Access Board with your concerns, and we have staff available to help mitigate those barriers. We also provide accessibility design guidelines and standards for the Americans with Disabilities Act, and also the Section 508 of the Rehabilitation Act, covering accessible information and communication technology. And then we also cover other standards as required by law and direction by the White House and by Congress. We also provide technical assistance and training on all aspects of accessibility and accessible design. And I already mentioned that we enforce the ABA, or Architectural Barriers Act. Next, I'll turn to the reason why we're here, really, and that is the executive order that was issued by the President on the safe, secure, and trustworthy development and use of artificial intelligence to help maximize the benefits, but also minimize the harms of emerging AI technologies. Under that executive order, the Access Board was assigned some tasks. First, to solicit public participation and conduct community engagement with the disability community and AI practitioners, including federal agencies. Second, we plan to issue more technical assistance as we gain more information and make recommendations on the risks and benefits of AI, including the use of biometrics as a data input. And third, we want to provide more information to people with disabilities and how to access information and communication technology, as well as transportation services. To help us implement these requirements, we wanted to partner with disability organizations who are well-known, well-connected, and well-versed in AI. And today we're going to be highlighting our 2 partners that we engaged with during a recent Memorandum of Understanding. So we developed a formal partnership back in May with the Center for Democracy and Technology, otherwise known as CDT, and the American Association of People with Disabilities, otherwise known as AAPD. On this slide is a picture of the team of people behind this effort from both organizations as well as the Access Board from our signing ceremony back in May. The key activities and the goal of this Memorandum of Understanding is to help with our community engagement and issuing recommendations. And again, today is our first iteration of web-based meetings and engagements. Next, I'd like to turn things over to leadership from both organizations of AAPD and CDT to tell you a little bit more about their organizations. First will be Maria Town, President and CEO, and second will be Alexandra Reeve-Gibbons, President and CEO of CDT. Maria, if you're on board, perhaps you can take the camera now. I'll stop sharing.
Thank you so much, Allison. Hello, everyone. My name is Maria Town. My pronouns are she, her, hers, and I am a white woman with long brown hair. I'm wearing dark red lipstick and pearls for visual description, and I serve as the president and CEO of the American Association of People with Disabilities, or AAPD. And first, before we really kick things off, I want to say Happy Disability Pride Month. And whenever I mention Disability Pride, I have to note that having disability pride does not mean being happy about being disabled all of the time. Being happy about being disabled can be a part of it, but I also think a key part of disability pride is having enough pride and self-love that you know you can demand more. And that is one of the things that we are excited about joining CDT in, is actually ensuring that federal agencies and allies like the Access Board are connecting with disabled people as they engage in a standards-making process for the use of artificial intelligence by the federal government. AAPD is a national disability-led cross-disability civil rights organization that looks to increase the political and economic power of the more than 61 million people with disabilities in the United States. When I say cross-disability, what I mean is that we do not focus on a specific disability experience or diagnosis. We exist to really increase the collective power across the disability community, whether that's people with mobility disabilities or developmental disabilities like myself, folks who have sensory disabilities, chronic health conditions, or emerging conditions like long COVID. We also, as I mentioned, are disability-led, so I have a disability, as does everyone else on our team and the majority of our board. One of the reasons that AAPD was founded in 1995, almost 30 years ago, was to ensure that disabled people access the benefits of technology. And this is one of the reasons why we are so excited to be collaborating with the Access Board and CDT via this MOU, because we know that AI has already become explosive in its many uses across employment, financing, benefits determinations, education, and more. And there are so many promising potential uses for these tools, but AI may also increase barriers and discrimination that disabled people already face. I'm very grateful for organizations like CDT that are not disability specific, but have really committed to disability in their work on technology policy and advocacy. And it's really through cultivating these partnerships, both across civil society and within government, that we will be able to create inclusive policy and standards for the benefit of everyone, but particularly disabled people. And so, Allison, I can turn it back to you, or I can turn it over to CDT.
Feel free to turn it over to Alex.
Okay, now it is my pleasure to introduce a friend and colleague, Alex Gibbons, who leads the Center for Democracy and Technology.
Thank you so much, Maria, and thank you, Allison. Hi, everybody. It's a real pleasure to join you. I'm Alexandra Givens. I use she, her pronouns, and I am the head of the Center for Democracy and Technology. As Maria said, at CDT, we are not a disability-focused organization, but our work is making sure that civil rights and civil liberties are preserved in the digital age. That means we think about different ways in which the benefits of technology have to be harnessed to benefit everybody, and how to make sure that the benefits of technology don't come at a cost to people's privacy or the equal access of different communities. That means that we do a lot of work on online privacy, on access to information, on the government's use of technology, including in the delivery of services to people, the use of technology in education and in the workforce. And in all of those places, we're working to make sure that technology really works for people. To us, it matters that we center disability issues in each of those different work streams that I described, just as we do for other forms of civil rights and protections for different communities across society. And we do that in a very intentional way, led by the work of my colleague Ariana Abulafia, who you'll hear from shortly today. For us, this partnership is deeply meaningful with the Access Board and with our dear friends at AAPD. For us, it really means centering the experiences of people that are working with these technologies themselves, that most stand to be impacted by them. In the world of AI, there's a lot of conversation and headlines in the news these days about AI risks and what responsible AI use looks like. We worry that sometimes those conversations focus on long-term and existential risks and not enough on the way that AI is impacting people's lives today, in their work, in their schooling, in access to benefits programs, and many other facets of daily life. So the type of work that we're doing is advocating directly to companies to make smart choices in their designs and their company practices, and then supporting important government agencies like the Access Board and so many of the other civil rights and consumer protection enforcers across state and local governments and federal government to make sure that they are taking a stand to protect consumers too. The other area that we are deeply focused on is how to make sure that the benefits of AI for disabled people don't come at a sacrifice to people's privacy, and that when tools are being designed under the guise of accessibility tools, they're being designed with disabled people at the table to make sure that the tools are working well, servicing the purposes for which they are intended, and again, really serve as a benefit to their designated users rather than just being sold in the market as kind of recipients of those technologies. We think there is so much potential here for collaborative work, and we're delighted to have this participation. The last thing I'll say is that this webinar today is designed to introduce people to the types of issues and open questions that we're seeing in the landscape right now, the policy landscape, and then also the landscape of companies designing and developing these tools and trying to make informed choices about how they do so. We hope it serves as an invitation in. We need more voices in these conversations, people with direct experience who can help shape those conversations and make sure that disabled people have power and voice in those conversations too. So even if it sounds a bit like a presentation, this is the start of a two-way conversation. And we hope you'll be active both in sharing comments and questions and then following up with us after as well. I'll close with just some gratitude to our partners at AAPD and at the Access Board and excitement to begin this conversation and this work with all of you. Thank you very much.
Thank you both. We really appreciate your partnership and look forward to this collaboration moving ahead. Next, I'd like to turn things over to Ariana and Henry, who will be taking over the bulk of the rest of the presentation, the conversation about AI and people with disabilities. Ariana and Henry, please move forward and sharing your, turning on your mics and turning on your videos, please.
Hi, everyone. My name is Ariana Abulafia, and I lead the disability rights work at the Center for Democracy and Technology, as Alex just mentioned. And Henry, is your video on? I see you. There you are.
It is. Hi, I'm Henry Claypool. I use he, him pronouns, and I am a technology policy consultant with the American Association of People with Disabilities.
And I'll just give a brief visual description. This is Ariana again. I am a youngish person with curly hair that at this point goes far past my shoulders. I'm wearing gray rimmed glasses and a pink collared shirt.
And I'll forecast mine. I have brown and gray hair, wearing glasses. I'm a white male, and I'm wearing a blue collared shirt today.
So Henry and I do quite a bit of work really ensuring that disability rights and disability justice and the perspectives of people with disabilities are centered in all of our work on technology policy. And that includes work on AI and algorithmic systems. But before we speak a little bit about, how these systems are impacting people with disabilities, we sort of wanted to take a step back and talk about, what is AI? And so AI, artificial intelligence, refers to how machines and computer programs can make decisions based on information. And so algorithms are these systems that create outputs based on inputs. So you can put data or information into the system, and then it comes up with an output that could be a decision or something similar. And we can go to the next slide. And so there are a lot of different types of AI. And some of y'all have probably heard of at least some of these. So machine learning can refer to when machines use training data to make better predictions. Predictive AI can analyze training data to predict future outcomes. Generative AI, this is one that a lot of folks have probably heard of and even used. And that can be used to create new content based on training data. And so there are all different types of AI. I think sometimes generative AI has become synonymous with AI, but there are all different types of it. And AI and algorithmic systems more generally are being incorporated into all sorts of systems used by people with disabilities and that people with disabilities are interacting with on a daily basis. And we can go to the next slide as well. And so one of the, again, kind of as we're taking the step back here, right? One of the things that we wanted to touch on briefly is, why would businesses or people or even federal agencies, why would they want to use AI? And so there are, at least theoretically benefits to incorporating algorithmic systems into processes. And so one of those could be that maybe an algorithmic system could increase efficiency, save time, prevent individual humans from needing to manually review something. At least in theory, a algorithmic tool could be used to analyze or to monitor, to go through, entire groups of data and pick out patterns or spot irregularities. And again, this sort of connects to what we were talking about in the last slide with generative AI. At least theoretically, AI can be used to generate content, to produce text, to produce images even, right? And there are text and image creation, services that use generative AI to do that. And so there are potential benefits and reasons why, again, businesses, individuals, federal agencies may use these tools. And what we want to do, and this is sort of what Alex and Maria as well were mentioning, is ensure that that folks can benefit from these tools, but while really centering civil rights and civil liberties and ensuring that risks are also mitigated. So we can go to the next. And so people with disabilities are also using AI right now. They are using them potentially for slightly different reasons than the ones that we just touched on in the last slide. And so AI, as an example, has been incorporated into assistive technologies. There are assistive technology apps, as an example, for blind or low vision folks that use and integrate AI. There are also automated captions that use AI. Some folks use AI for medication reminders. Some folks use it for adaptive smart homes, for smart mobility devices. There are all sorts of uses for AI, but and going back to sort of what Alex mentioned, some of these uses may very well implicate things like data privacy or personal privacy. And so as we sort of think about using that framework of maximizing benefits and minimizing risks, we want to think about not only the risks of potentially discriminatory outcomes, but also things like how to safeguard privacy, and again, centering civil rights and disability justice. So we can head to the next slide. So sort of as I mentioned before, and all of this is somewhat foundational. So artificial intelligence and algorithmic systems, they create outputs based on inputs, right? And those inputs are data sets that are sometimes called quote unquote training data. And so sometimes those data sets, they may not have accurate information about the disability community. And there are all sorts of reasons for that. It can be difficult to define disability, or for us as people with disabilities to land on a definition of what disability is. There is still stigma connected to openly identifying as a person with a disability that could also impact accurate data collection on the disability community. And then there are also exclusionary data gathering practices. And so all of those things kind of together can create this environment where the data that's used to train these algorithmic systems or these artificial intelligence systems, those data sets may be under-inclusive or even entirely non-inclusive of people with disabilities. And when those algorithmic systems are trained and created based on those data sets that are under-inclusive or non-inclusive, they're quite likely to create discriminatory outputs or outcomes, or just disproportionately negative outputs or outcomes for people with disabilities. And so one way to think about this work, right, again, I'm going to keep kind of going back to this work of maximizing benefits and minimizing or mitigating harms for people with disabilities and artificial intelligence. One of the ways that I like to think about that work is I like to go back to sort of traditional precepts of disability rights and disability justice. And so one of those is, the ideas of inclusive design. And we can think about how to inclusively design algorithmic systems. And one of the ways to do that is to ensure that our data sets are representative. And, another precept I go back to quite a lot is nothing about us without us, right? Ensuring that people with disabilities are involved and are centered in all of this work. And I'm going to absolutely go back to that later. And so I think we can head to the next slide. And so I'm going to turn it over to my colleague, my good friend, Henry Claypool, to talk a little bit about how AI impacts people with disabilities in various systems, starting with employment.
Thanks, Ariana. And as she mentioned, employment is a great example because we actually already have federal agencies on the record here cautioning that companies using AI may be discriminating against disabled people. So how might that happen? And I just wanted to give you a couple of examples here. First, we can look at using automated employment tools like resume screeners, personality tests that might be administered through a platform, video interview that are analyzed to see how those people sitting for the interview do. They're often used during the hiring process, and they all incorporate algorithms in their use. And how do they discriminate against people? Well, for example, neurodivergent people may perform differently on personality tests, and people that are blind or low vision may, that the video interviews may be tracking the eye movement. And so a blind or a low vision person will obviously have perhaps different eye movement, and that won't track with what the system is trained for. Another example is people that may have had a stroke. They speak at a different cadence. And so is that system going to really be able to pick up and accurately understand and interpret what's being said by that job applicant? So those are all just real concrete examples. These are also really very basic and used in screening resumes. So in that screening of a resume, you think that's fairly harmless, but just think about the fact that a disabled person might have a gap in their resume because they had a disability-related absence from work. And indeed, one of these systems could flag that as an applicant here with a spotty employment history. And so this technology is really it's being used quite broadly now by most employers and in some shape or form. And so it's important for people to understand the implications of AI, and for those working on these issues to really be able to engage with the technology in a way so that they can understand how it impacts them in their job hunt. Another example of how technology is used on the job is there are sometimes systems that monitor employees, and they will look at how you enter keystrokes, or is your mouse active? And you could imagine that a disabled person might do their work in different ways using these input systems for their computer differently. And so this monitoring or surveillance system that is tracking the employee is really prone to misunderstand how that disabled person is performing on the job. So we're really pretty concerned about how these surveillance tools are being used on the job. I think one of the takeaways from this, Ariana mentioned data privacy, and here where we see this kind of broad surveillance of employees, you also start to wonder what the privacy implications are for the individual. So here's another area where you can see these issues are not easily discussed separately. They really come together when technology is used, and specifically AI. There's another area that I wanted to venture into around how technology impacts disabled people. And it has to do with benefits determinations, or the administration of benefits. Now, governments are using these tools, these algorithmic systems, to really make some determinations about whether or not individuals are eligible. They are using these systems to source information to aid in those determinations. So we're really seeing that they are being used in the process of making the determination, but they're also being used in ways that may set up a determination, and we also want to be aware of the impact there. So why is this being done? These agencies of the government are often working to reduce fraud or waste and abuse that might be in the system, or they're really trying to create efficiency. And when they adopt these algorithmic tools to do so, they may not have been thinking about the implications on people with disabilities and all the varied ways that we interact with the federal agencies and the state agencies that administer these programs. So to be clear on the eligibility assessment, they're often used to kind of flag people that are, say, fraudulently applying or receiving benefits. And that's been cited as a reason for doing this and wanting to make sure that only the deserving people get the benefits that the government is putting out. What are the implications for people with disabilities? Well, it may end up, if you think about the context of home and community-based services, for example, if these systems are being used there, someone with a disability may be undergoing a functional assessment, and there's a determination that's being made about some of their needs. And the motivations of the agency is to try and make sure that the right amount of services is allocated to the individual. But they're starting from a place where this isn't really an exact science. And therefore, making decisions in the absence of empirical evidence about when and how much service each individual needs can be really challenging. So the system is set to do an assessment of the individual, and say it's someone who's already been allocated services. And the reassessment that they undergo makes a determination that they're receiving too many hours. And so the system then decides that the number of hours of home and community-based service that the person is receiving should be reduced. And this is an example that has actually been litigated in court. And so we're comfortable sharing that with you today as a really concrete example of how an algorithmic system is being used in this kind of benefits determination process to either try and make an appropriate assessment, but often or can have this unintended consequence of reducing services inappropriately and denying someone their right to due process, which is how the cases have been decided, I believe. And so that's, again, an example of how technology is being used today in benefits determination. Right now, we know that other agencies are using the technology, as I said, to source information to help those individuals that are responsible for making a benefits determination to get the right information so that they can then make a decision. And one of the challenges there is that it may be really helpful in going out and finding the known sources of data, but is this really the universe of data, or is this the entire data set that should be used in that benefits determination? And so some of this work is underway, and if you'll, as we engage in this process with the Access Board, I think we'll have more to say on how federal agencies are using this technology and these algorithmic systems in the benefits determination process. And looking now forward to passing it back to Ariana so that we can actually do a little back and forth on a couple other points. So Ariana, did you want to open up on healthcare?
Yeah, absolutely. So I'll hit this slide, Henry, and then you can get the next one. So another one of the areas where we are seeing, impacts on people with disabilities with AI and with algorithmic systems right now is in healthcare. And so obviously, similarly to benefits determinations, these are areas and systems where, an algorithmic tool that goes wrong or that has a discriminatory or a negative output or outcome can really have a very significant impact on a person, particularly a person with a disability, and the stakes can be very high. And so when we're thinking about AI and uses of AI, I think it's really important to talk about those areas like employment, where, a discriminatory AI tool could lead a person with a disability to unfairly being screened out of a job or being even fired from a job, or benefits determinations, where a discriminatory algorithmic tool could lead to a person, as Henry mentioned, having their, home or community-based services, their hours really significantly reduced, which could drastically impact their lives and also their independence, their ability to live in their communities. And with healthcare, what we're seeing is there are all sorts of different healthcare decisions that are being managed by algorithmic tools and algorithmic systems. And again, before I kind of dive into what some of those are, I'll take a step back here and talk a little bit about some of the potential issues that there can be whenever, not just in healthcare, but in other contexts, whenever algorithmic tools are being used to make decisions. And so in the vast majority of, situations where algorithmic systems are being incorporated into decision making, there are what's called humans in the loop, meaning there are people who are or should be involved in making those decisions. And that is a good thing. But it's worth questioning, right, who the person is who's involved. And as an example, in the context of disability or in the context of healthcare and benefits determinations and things that really significantly impact people with disabilities. Are they people with disabilities? Are they people who may be multiply marginalized, who may experience systems in different ways? But there's also questions about, where in the loop do they get to be involved, right? And also, there is a phenomenon called automation bias. And what automation bias refers to is this idea that people sort of naturally will defer to what an algorithmic system says. Sort of the idea of, well, the numbers can't lie or the machine must be right. And that sort of sheen of correctness that may come along with an algorithmic system can be referred to again as automation bias, but it can also impact the effectiveness of having quote unquote humans in the loop to evaluate algorithmic decisions and algorithmic systems decision-making abilities. And so I say that sort of as as sort of like a table setting. And I also say that to go back to kind of what I had teased before, right? Which is this idea of nothing about us without us, right? That people with disabilities have to be, quote unquote, in the loop and included and centered in all stages. And that means algorithmic system development. It means, creation, procurement, deployment, auditing. People with disabilities should be involved in every single step of that to try to reduce, again, not only those discriminatory outputs, but even what comes before that, right? Potentially those things like that automation bias. And so healthcare is one of those areas where people with disabilities have the potential to be very significantly impacted. And so there, as I mentioned before, there's all sorts of healthcare decisions that are being managed by algorithmic systems. And so one example of that, and the name of it has varied depending on, who's talking about it. So sometimes they're called triage algorithms, sometimes they're called mortality algorithms, sometimes they're called vulnerability indexes. And these are algorithms that can determine, what level of care someone gets in a hospital. They may even determine who stays in a hospital and at what point that person is discharged from the hospital. And a lot of those decisions are being made, at least in part, with help from an algorithmic system. There are algorithms that help determine who gets transplants and who's next in line for transplant. There are algorithms that are generally referred to as opioid use or opioid treatment algorithms that determine, or at least help determine, who may get a painkiller at what dosage and at what frequency, or if at all, after a procedure or surgery, right? And so these are just an example of some of the treatment decisions, the healthcare decisions that are being at least partially made with help from algorithmic systems. And again, it's not that the AI necessarily, or the algorithm necessarily, has the be all end all voice quote unquote, or be all end all decision making power. But when you think about things like, again, this phenomenon of automation bias, where individuals may be more likely to defer to what an algorithmic system says, there are questions there as to just how much influence these algorithms are having on healthcare decisions and healthcare decision making. And so one of the reasons that this can be a problem is because of multiple marginalization, right? So, and again, I'll take a step back, but multiply marginalized disabled people generally refers to a person with a disability who belongs to, as well, any other marginalized group. So that can be people of color, LGBTQ people, etc. And so when you're talking about multiply marginalized individuals and you're talking about a system like healthcare, healthcare is a system that is fairly well known for having certain biases that impact people. So there are gender biases, as an example, towards women that have been written about and studied about in healthcare. And so when you may have, let's say, a disabled woman or an LGBTQ disabled woman or a disabled woman of color, and we know that there are these issues with, racial bias or gender bias in healthcare, and you add that to disability bias that may exist in healthcare, algorithms can serve to be a force multiplier and to amplify those, rights-based concerns instead of to mitigate them or to reduce them, right? And again, like kind of going back to the overarching framework for all of this, if we're thinking about, the best ways to ensure that there are benefits that can be had from these systems. And again, right, at least theoretically, there are benefits that these systems could have by increasing efficiency or reducing abuse, right? Or as Henry mentioned, in the benefits determination context. And I think those same justifications apply to healthcare. But the concern, right, again, is ensuring that those things aren't being amplified, the rights-based concerns aren't being amplified in an attempt to increase efficiency or take advantage of any other theoretical or actual benefit of algorithmic systems or AI. And so, Henry, I think the next one is for you.
Thanks, Ariana. So next, we've got biometrics, and of course, what is biometrics? Using our bodies basically to access things, or in this case, interact with technology. And so facial recognition, people are fairly familiar with it in using a phone or some other system like that. And thumbprints have long been used to identify individuals. Retina scans are something that often triggers a facial recognition system looking for retinas to identify when the person has presented themselves. And so those are examples of the biometric uses. And I think the impact there is for people with disabilities is pretty straightforward, that not everyone has a shape of a face, or a face remains the same over time. And it may change periodically due to health or disability related reasons. And not everybody has a thumbprint to give. And retina scanners, very similar. Retina might not be something that the individual has at the time that they're interacting with this technology. So the designers of these biometric systems are often not thinking about us. And that's why we want to bring it to your attention today and have you thinking about this for your interactions with technology, and more equally as important, for the process that we're engaged with the Access Board. And you'll hear more about it from Allison in a few minutes. But I wanted to talk a little bit about the impact here of these systems and how they're used. And a great example is when you're going to the airport nowadays. If you sign up for a certain program, you may be eligible to have a facial recognition tool used to allow you to move more quickly through a line at the airport. And that's all based on your face matching up well with the image on your driver's license. That's the training data that the system is using. And for some disabled people, that may not work very well. And so the design of these systems, again, may present real problems for disabled people when they're trying to interact with them. Again, you'll see on this slide, we have a bullet point calling out privacy again. And the next time you interact with these systems, you can be thinking about how much information you're giving about your body in data privacy here. You're giving an image of your face to a system. You may be giving away quite a bit of information about yourself, and how is that data then used? So it's something to think about, and hopefully it will inform a process that the Access Board has underway. And I think, am I going now to Allison for our wrap up, Ariana?
Yes, indeed.
Great.
Thank you again, Henry and Ariana, for your contributions in this space. I wanted to share something else as we transition to some concluding remarks, in that early on, I felt a little bit, early on in our conversations, I felt a little bit intimidated about the AI conversation. As a person with disabilities, I'm not as familiar with this technology. I've learned so much from you all, and I hope that our audience has learned something new today as well. It's so important that as we look at AI, that we do maintain that right balance between privacy, data equity, inclusion, and really accessibility. I think we're continuing to talk about this. We need more people with disabilities at the table. And I also want to drive the point home that if you're not savvy about AI technology, and you are savvy or have some knowledge or experience from your disability rights perspective, and or you're working in this space as an AI practitioner or at the federal agency in an AI role, we want to hear from you. And in a few minutes, I'll tell you a little bit more about next steps. But overall, we want to reemphasize that we need to be at the table as people with disabilities, be part of the conversation as this continues. This technology continues to expand and be used in all areas of life moving forward. We are really, really excited to be partnering with CDT and AAPD, and we look forward to hearing more from all of you. So let me pivot to next steps. There are 3 ways to engage moving forward. The first one is we are hosting 2 disability community hearings, and I'll provide a little more detail in a moment about how to do that. The second, or rather third, web-based event will be specific to federal agency and AI practitioners. This will be a hearing giving them an opportunity to share information about their experiences and perspectives as it relates to equity, accessibility for people with disabilities. And then ongoing feedback is received through a new email account we've set up, just listed as ai@access-board.gov. You can also receive ongoing updates about our work in the AI space and other areas of Access Board work by signing up for our Access Board news. We will have new updates by close of business tomorrow, so jump in this opportunity, visit our website, and I believe that one of our staff, Amy, is posting the link to sign up for our Access Board news in the chat, but it is easily found in our news tab on our website as well. So let me dive a little deeper and talk about some specifics and logistics about the upcoming events. The next web-based event will be August 8th, 2024, and this is again virtual and for the disability community. We're going to host 2 sessions on that day. The first one will be at 10 to 12 a.m., probably more effective for people on the East and maybe in Midwest. And the second session will be hosted in the afternoon at 2 to 4 p.m. Anyone can join the event through the Zoom link, which is posted in the slide deck and will also be posted in our website as more information is developed in the near future. No passcode will be required, and no registration is required to participate. The next event will be hosted on August 22nd. Again, this will be for federal agency and AI practitioners presenting their perspective on AI and equity and accessibility. That again will be at 2 to 4 p.m. in the afternoon East Coast time. And again, no passcode or registration is required to participate. So let's just talk for a second about speaker registration. It's actually the same for both events, or all 3 events. Anyone who wishes to speak and share their perspective is encouraged to pre-register with us. It is required. Space is limited, and we will take our registrants on a first-come, first-served basis and then establish a wait list in case other people are not able to keep that commitment. Each speaker is allocated 2 minutes to present their comments. If you're interested in presenting, please just send an email to the following email address. It's simply events@access-board.gov. Whoops, I moved a little fast, sorry. Again, it's pretty consistent for all 3 sessions, but basically, please note in the subject line which session you would like to present your comments. For the disability community, please note if it's AM or PM on August 9th. Please also include your name, the organization name if you're part of an organization, and the specific AI topic you'd like to present on. Sign language interpreting and captioning will be provided at all of these events, but if you have an additional reasonable accommodation or accessibility need, please also send an email to the same email address, events@access-board.gov, and please submit your request by July 30th. Similar to the disability community events, the same information really, just if you want to participate as a speaker, please send an email to the same email box and reference in the subject line that you'd like to participate in the August 22nd event on AI practitioner and federal agency speaker registration. You also have an option to submit written public comments. So if you are not comfortable speaking online in this public forum, you may also submit your written comments that will become part of our official record. So similar, you just send an email with your comments, include in your subject line AI written comment, and send it to events@access-board.gov. Include your name, organization, if applicable, and the specific AI topic with your comment. All written comments are limited to 300 words, and the deadline for submission is August 31st, 2024. I also wanted to share the contact information for our partners, the American Association of People with Disabilities. Their email address is here, communications@aapd.com, and the website is simply aapd.com. Center for Democracy and Technology, email is hello@cdt.org, and their website is cdt.org. And you can look in the disability rights section, looking at privacy and data. Next, we have contact information for the U.S. Access Board. I referenced earlier our specific email box regarding AI questions, inquiries, and other needs. That email address is ai@access-board.gov. And the website is access-board.gov. And again, just a reminder to please subscribe to Access Board News to receive ongoing updates and information about this effort and others throughout the Access Board's work. At this point, I want to thank you so much for participating in this first event, and I wish you a good day and look forward to hearing from you soon. Thank you again to all our presenters and all the Access Board and organization staff who contributed to the success of today's program. Have a great afternoon.